Hi, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you're watching Aging Strong, which is sponsored by the Quincy Health Department. And today I have a special guest speaker. I've had her on before. She is my counterpart from Brigham and Women, Mass General. Her name is Maria Tamang. And what we're going to be talking about is injury prevention in terms of trauma awareness. That's our role, is to bring awareness about injuries to a lot of different populations. And today, our goal is to inform you about our role specifically as hospital-based injury prevention professionals. So Maria, welcome.
Hi, Debbie. Thank you for having me on your show. It's always a pleasure to be here.
I love having you on because you're a wealth of knowledge. And I know that in the spirit of partnership, we love to collaborate. We just love taking trainings together and we like supporting each other's efforts. So I really appreciate that. So I'm going to pull up our slides just to inform people about what it is that we're going to be talking about. Trauma prevention. So May has a lot of awareness days of celebration. I know there's Mother's Day, there's Nurses Week, there's mental health awareness. There's also trauma prevention or trauma awareness. It's a month where we really want to highlight different types of injuries that can be prevented. And that's where Maria and I come in. So trauma patient experience. As far as the hospital systems go, there are some hospitals out there. There's a lot in the Boston area that's considered a trauma center. Tufts Medical Center is one of them, and Brigham and Women, Mass General. We'll talk a lot more about that. But to become a trauma center, we need to have many different systems in place. But just to kind of walk you through the trauma patient experience, we have this little diagram here. So an injury occurs, right? And before that occurs, hopefully there's been some education from injury prevention professionals about how to be careful, what to do to help reduce any type of injuries from happening. But you know what? We're only human and things happen. Sometimes injuries are unintentional. Sometimes, unfortunately, some injuries are intentional. And so, from looking at this map here or this flow chart, you can see that there's injury prevention that's occurring, hopefully from the doctor's office or wherever it is that you would be getting this type of information. Unintentional injury can occur. And then there's the first responders. That can be the EMS people, paramedics, who can transport you from the place where you had the accident or injury to a trauma center or an ER. In the ER, if the hospital is a trauma center, they will have designated teams of doctors, specialists who fall under the trauma department, who are there to really take care of you, to assess you, and if surgery is needed, they'll whisk you away. And then after a person heals, recovers from their injury, they either go home or sometimes they go to a rehab. So that's pretty much what captures the patient experience from injury prevention, injury, first responder, hospital to home or rehab. All right, so injury prevention professionals, who are we? We are designated professionals. We could be social workers, we could be nurses, who offer outreach programs based on the MOI is mechanisms of injury, based on the trends that's happening that we're seeing in our hospitals. Okay, so our programs aims to take care of the top mechanisms of injury from our hospitals. That's what informs our programs. So who do we do it for? We do it for, as adult injury prevention professionals, we do our programs for people aged 17 and up. And because our top mechanism of injury is related to older adults, we do a lot of our programs in senior centers, And sometimes we do it in hospitals to teach our own peers about what's happening. We do it in conference rooms, schools, outdoor health events, virtual, and even parking lots. All right, Maria.
Okay, so actually, a lot of people don't actually understand what this trauma center is. So that's what we're going to try to do is clarify the system a little bit more. So basically, a trauma center is a designation that's given to a hospital. So firstly, it's a voluntary thing that hospitals have to apply for. They're not compelled to become a trauma center. Trauma centers choose to become a trauma center, and there are different levels of that, and we'll talk about that in a little bit. So in order to become a trauma center, two things have to happen. There's the designation, and then there's verification. So designation basically is done at a state or local level. So what happens is they determine the criteria that defines what levels have to be, what criteria are in each level. So basically, a trauma center has to meet certain criteria to be a level 1, 2, 3, 4, or 5. And the state or local level determines that criteria. And then the second part is called verification. And this is done by the American College of Surgeons. So the American College of Surgeons has nothing to do with the designation, what level you are, what level each hospital is. All the American College of Surgeons do is they verify or they make sure that the hospital actually has those resources, the staff, the education that is required for each level. So as we mentioned before, there are different levels. There are actually 4 or 5 levels depending on the state. So there's 1, 2, 3, 4, and 5. If you can just move the next slide, please.
Yep.
So here we have trauma center levels. So an example of level 1 is Brigham and Women's Hospital, Tufts Medical Center, Boston Children's, Mass General, and there are a couple more in Boston itself, but there are several all over the state. A level 2 trauma hospital is something like South Shore Hospital, St. Luke's Hospital. And then level 3, we have several of that. So Lowell General Hospital, North Shore, Good Samaritan. Those are some of the level 3 hospitals that we have. So to talk about the levels, as I said, there's 1, 2, 3, 4, and 5. And 1 is the top, and 4 or 5 is the lowest. So essentially what defines each level are the kinds of resources that the hospital can offer to the patients. So that's 1. And then the second one is the number of patient admissions each year. So if those between those two criteria determines what level each hospital can become. So a level 1, for example, and that's the highest, and it offers the most comprehensive services such as trauma nurses, doctors, 24-hour presence of a trauma doctor and trauma team, as well as other specialties. So you'd have cardiologists, neurologists, orthopedics. So those would all be available 24 hours a day. And they also go from injury prevention, as Deb had mentioned, and so we do education, research, rehab. So it's a very comprehensive criteria. All the level 1 hospitals that we mentioned here are able to offer those services. The level 4 or level 5, on the other hand, that's the lowest. So they're able to offer assessment. So they don't have the 24-hour services. They may not have rehab, but they can offer assessment and the ability to transfer patients to the next level hospital, which is essential because if they can't offer the services for the type of injury or the type of trauma that a patient comes in with, they have to be able to transfer them to the hospital that can offer those services.
I mentioned MOI before, mechanisms of injury, which basically means the way in which a person is hurt. And so we, on the left side, we have the nationwide mechanisms of injury. You can see that fall is off the charts pretty much. It's just the highest. And then the second one is struck by or against, which we would call violence. It could be struck by somebody with a bat, or you could be stabbed, or it could be gunshot wounds. The next one is motor vehicle accidents, and that could be a person driving in the car, or maybe a person, is hit by a car, anything to do with the motor vehicle. And then on the right side, we wanted to compare our numbers compared to the national numbers. So although we have the 2021 nationwide numbers, we wanted to give you as recent of a data as possible. So here we have the 2022 top 3 mechanisms of injury. In the blue, you'll see the Brigham and Women's. You see how high the fall rates are. And same thing with Tufts Medical Center, which is in orange. That's also our highest. And then second is motor vehicle crashes. And then third for us is violence. So interesting, you can see how the data here, it shows both in both the nationwide and also local wise, how falls is number 1. And then depending on the location, for us in the Boston area, it's motor vehicle crashes and then violence. In comparison to the national data, they have the violence as second, and then the motor vehicle crashes the third. So it depends on the location of the hospital and the state that they live in.
And I just wanted to mention, Deb, that falls are actually, this data is actually from under 1-year-old all the way to over 65, all the way to the elderly.
Yeah.
And it's number 1 for basically, especially for the nationwide, it's the number 1 mechanism of injury for every single age group.
Yeah, it's really incredible. And you know what? Beyond this country, globally, falls, especially older adult falls, is number 1. Because the population is aging, we're getting older. And, so along with that comes so many different factors that can possibly lead to falls. It could be their own medical condition, could be medications, it could be them just being deconditioned, so many different factors. Evidence-based fall prevention program. So to answer the question, or to answer or take care of the problem of the top 3 mechanisms of injury, our role as injury prevention professionals is to do something about it. We need to take care of that problem. And that's why we offer different types of evidence-based fall prevention program. And evidence-based basically means a program has gone through rigor, and scientists have proven that it does work. It has positive outcomes. And so those are the type of programs that's highly recommended to be implemented in different locations. And you'll see later on that, there's some programs that might be evidence informed, meaning borrowing from research, creating a program that is informed by research. But here we have different types of programs. You see the Matter Balance, Aging Mastery Program, Bingo Size, Stepping On. That's, we say, multifaceted because it touches upon different sectors, different factors that can really help support a person to help them become stronger. And then there's exercise focus, which Maria will, talk about later on, Tai Chi for arthritis and fall prevention. She's trained in that. There's also different types of Tai Chi programs, which is Tai Chi Guan, Moving for Better Balance, Enhanced Fitness, that's offered by YMCA. There's the Otago exercise program, and there's also SAIL, which is Stay Active and Independent for Life.
I would encourage everybody, if you see any one of these programs, to check it out. There's different senior centers, different community centers, different hospital-based organizations like ours offer them, and we don't always offer the same things. We offer different programs. So if you see any of these programs being offered, please check it out. See if that's something you'd be interested in doing. See if that's something that, you could stick with. And because it's really a good thing to take. And many of these programs are also free for the community.
Yeah.
So if a hospital-based program, a hospital-based injury prevention offers it, such as Debbie and I, it's free. So it's always a good thing to check. And then the other thing I wanted to mention is that most of these programs are long. They're not like a one and done type of thing. It's more of, it takes a few weeks for the program to be completed. So usually it's a few sessions, it's a few weeks. Like Tai Chi for arthritis and fall prevention, that's a 16-week session or an 8-week session, depending on how many times you have it. But so these are not a one and done programs, which I think is important to mention, because a lot of times, people can't always commit when it's a long stretch.
Yeah, I'm glad you said that, because there's really no magic pill that's going to help somebody all of a sudden after taking one program. Oh, okay, I'm strong. No, it doesn't work that way. It took a person, many years to maybe become deconditioned. So it's going to take a few sessions to help them create positive habits and maybe start incorporating any type of exercise into their lives to become stronger.
And you're right about, incorporating. That's really the important part, is it has to become part of your life, part of your lifestyle, part of your everyday, because you learn, certain things in these programs and you have to incorporate them into your daily life. You can't just do it for, however many weeks that you're taking this program. And then after that, it's like back to the normal, back to before. It has to be, whatever it is that you've learned has to be incorporated into your daily life so that you can maintain the benefits of the program, which, as Deb said, it takes time for benefits to develop. So for strength, for balance and all that, it takes time for that to develop, and to maintain it, it needs to be done pretty much every day. It has to be incorporated into your everyday life.
I agree. And also, I would even encourage people to take it again after a few years, because the body, as we all know, change. And, it's good to have reminders. It's good to be able to learn how to move your new body or your, aging body in a different way. So that way you're less likely to have unintentional injuries.
Yeah, that's a really good point. That's a really good point. I totally agree with that.
Talking about evidence-informed fall prevention program. So here are the programs that I offer. And I offer it in the Boston area, I offer it in the South Shore, and also offer it virtually. So there's quite a few. The first one is Aging Strong. And these are the people from Lower Mills who participated in the program. It's 4 sessions long. And it talks about, importance of movement, and then stress management, and being your own advocate when you're talking with specialists, doctors, and just helping you to be able to think about different ways that you can age strongly. And then Aging Strong program, the second one, it does have the same name, but it came about because of COVID, when I couldn't do in-person programs. So fortunately, I was able to partner up first with the Quincy Public Library, but now I am partnering up with the Quincy Health Department, where I do this program virtually over Zoom twice a month, and I invite different guest speakers who can talk about topics that are really interesting and relevant and empowering for older adults. So, they can run the gamut from, talking about advanced planning, or it could be older adult driving, it could be Social Security, fraud, different ways that you can volunteer out in the communities. So, lots of different topics. And you can catch that on YouTube. There's also mindfulness for healthy aging. I was just doing that today at the Quincy Council of Aging. Lots of people who took that same program a few months ago are taking it again because they just love the aspect of the reminders, helping them remember that it's important to take deep breaths. It's very important to, notice different things so that you're less likely to have unintentional injuries. And also I've added prepare for surgery and also fall prevention programs and stress first aid. So because we do have a little bit of time in our hand, Maria, do you mind if I do a little bit of a mindfulness breathing exercise, just so people will have an idea of how they can, use their breath to help them age in a healthy way?
No, actually, I was going to ask you to talk more about this, particularly about the mindfulness for healthy aging, because I feel like nowadays we have so much more stress, and I personally need to learn how to, take time to relax and de-stress. And there's so many ways to do it, and not every way works for everybody. Mm-hmm. So would you actually talk more about it before we go to your demo?
I would love to, because there's so much about our breath. When we are stressed, our breathing changes compared to when we are relaxed. And also there's something to be said about breathing through the mouth and out the mouth compared to breathing in the nose and out the nose. So there's a lot of research out there that talks about the importance of nasal breathing. And you're probably thinking, I breathe through my nose all the time. That's good. But there's some people who are not able to. And those people who are considered mouth breathers might end up with certain health conditions. So I invite people who are watching to notice their breath. Notice if they comfortably breathe in through the nose and out the mouth. And also if they're able to breathe in through the nose and out the nose. Because when you're able to do the nasal breathing in the nose, out the nose, then you're activating the nitric oxide in your system, which can occur in your sinuses. And when you do that, you're releasing nitric oxide, which has been helpful for boosting the immune system. It opens up the blood vessels even more so that you're able to have better circulation. And when that happens, it helps with your blood pressure too. It helps with healing. It helps with so many different factors. So breathing, noticing how your breathing is during a day, noticing if there's anybody or anything that makes you hold your breath, like either from being upset or being in shock or just being overwhelmed. Noticing when that happens, because when you mindfully take note of that, then hopefully you're able to catch yourself and you're able to bring your breath down to your belly, breathing in deeply, which can help you relax even more. And also noticing what it is or who it is in your life that takes your breath away. What is it that makes you feel like, oh, that's so wonderful, puts you in a state of awe or gratitude, like sunrises and beautiful flowers or beautiful, just nice acts of kindness that you witness from somebody doing something really wonderful. So noticing,
I totally agree.
Yeah. So there's a lot of nuances there. Yeah.
And I think, just practicing those positive thoughts. I mean, it's very cliche to say, oh, think positive thoughts, but it really does help. I think just doing things that make you feel good, that make you feel, or that fill you up, positive things that fill you up and make you feel good, I think contributes a lot to physical health and mental health and emotional health.
Yeah. And you know what actually was really interesting today when I was having my participants sign in for the Mindfulness for Healthy Aging, one of the participants asked me, is this an injury prevention class? I said, yes, it is actually. I thought this was a mindfulness class. I said, yep, it's a mindfulness class. But I said, it's an indirect way, this program, the Mindfulness for Healthy Aging, is an indirect way of teaching people to prevent injuries, because when we are mindless, we tend to walk into things, or we drop things, or we, bump our head, or slam our door, the door on our fingers, or maybe say something that we regret, or maybe take a misstep and then twist our ankle. So mindfulness is really important for us to become aware of what we're doing at each moment.
Exactly. I agree. A lot of times too, I think this helps towards depression and loneliness and anxiety. Three things that definitely contribute to falls and injury.
Yeah, definitely. And that's why, when data started coming out about depression and loneliness, how it impacts falls, how it puts people at risk for falls, I said, okay, it's time for me to really start introducing more mental health, more mindfulness type programs, because it's so needed out there, definitely. And people, it's so well received because it's something, when you're in front of somebody and they seem relaxed and calm, that makes you feel calm, doesn't it? As opposed to somebody who is, breathing really fast and very anxious, or having like some sort of a shortness of breath. You yourself start mirroring that because something is off, and you feel like, okay, what's going on with this person? So there's a lot to be said with our breath and how we're able to manage it. Because, there's a neuroscientist, Andrew Huberman from Stanford University, and he says that when we have a lot of mental things going on in our head, like maybe it's like overwhelm or anxiety or worry or depression, the best thing to do is to do something with your body. So it's hard to take care of something mental with something mental. So if you're having some sort of a mental event where you're having a panic attack, or you're nervous, or you're anxious, very overwhelmed, do something with your body, because then you're able to redirect that energy. And that could be as simple as taking deep breaths, or going for walks, or listening to music, or making yourself a cup of tea. So these require movements. And so you're able to hopefully disconnect from that hamster wheel of whatever it is that's ruminating in your mind that's causing a lot of stress and suffering.
For me, breathing works very well. And but I do have to consciously do it, which I do not do often enough, I feel. So aside from breathing exercises, are there any other types of exercises that would bring about, positive thoughts, would bring about just a relaxation state, bring you or bring you back to the present, bring you back to the moment, and hopefully, lower that stress, lower that anxiety?
Yeah, well, there's a lot. So one that comes to mind is gratitude, the practice of gratitude. That has been a tried and tested practice where it's been called an instant happiness booster. When you start practicing gratitude, being grateful for something. So, a lot of researchers out there, they say gratitude is more than saying thanks. It's you realizing you're a part of something bigger and better. And that could be the sunrise, witnessing a sunrise, knowing that you had nothing to do with that. And it was just, just life being beautiful. And so finding something to be grateful for, whether it's the nice weather we have right now, or the computer, or the Wi-Fi working, or you breathing at all, having a chair, having a roof over our head. There's so many people across the globe who are running for their lives right now, sense of security. There's so much to be grateful for. So when you commit to that type of a practice, gratitude has been shown to boost your sense of well-being and also increase your immune system. It helps with your social connection. If you're working, it helps people, get promoted more. They tend to make more money, and gratitude also cancels out envy. So for people who are envious, practicing gratitude makes you feel full and rich. And when you're in that state, you feel like, oh my gosh, I'm overflowing. And you tend to kind of do nicer things for other people too, which is kindness, the act of kindness.
That's great because it's one of the issues with me, especially, and I can only speak for myself, is I always like look at people who know how to practice mindfulness and say, I don't know how to do that. So I think that's why taking a class like this, for example, would teach me strategies on what I can personally do to be more mindful, to be more present,
Yeah.
And it's not, I don't think it's something that comes naturally to many people. It
Well,
doesn't for me anyways.
I want to challenge that by saying, you can put yourself in a mindful state, and I'm sure you have been, and many people have been in mindful states when they're doing something that they love, that they lose track of time, that they just feel like, they're in that zone, like swimming. I know you're a swimmer, so I'm sure when you are swimming, you are just, you're feeling the water, you're watching your breath, you're pacing yourself, and you're just stretching your arms and moving your legs in a way that, is beautiful for some people. And yet that is it's a mindfulness in motion, what some people would say. Okay. Likewise, when people are painting and they're painting this beautiful portrait, they might say, oh, that's not mindfulness. But a mindfulness practitioner might say, well, if you lost track of time, and if you're really trying to figure out the different colors and just making sure that everything is just so and so perfect, then you could possibly be in a mindful state. I love to paint, and I haven't painted in a long time, but I remember when I used to paint little beach sceneries, I would have a little brush, and when I would paint, I would feel like I was actually there. If I was painting a beach scene, I would feel like I was there in the beach. That's how I would kind of like get transported in a way. And that is a mindfulness state right there.
I'm so glad you said that. Now I feel better. I feel better about my, because you're right. Like when I walk, I notice the wind. I notice and, just breathing in the fresh air. I notice like how hot the sun is.
Yeah.
So there's hope for me yet, is what you're saying.
I'm just saying you are a mindfulness guru and you're just not embracing it.
Thank you. I'm so glad you pointed that out. I feel so much better now.
All right. So I know we want to make sure that we talk about the programs that you offer. Okay. So here, I'm going to move the slide, and here you are in mindfulness in action. Okay.
Yes, indeed. So the programs that I offer are evidence-based programs. So two of them would be Tai Chi for Fall Prevention. And we do that in person, as the picture shows. And, you're right. Because when I'm teaching it, I'm, watching everybody. I'm watchful of what I'm doing, where I'm putting my body, where I'm putting my hands. So yeah, you're right. I am being mindful. Go figure, right?
Yes.
And then, so this program has been really good for me as well, because when I do it at home, even when I'm not teaching, and I do it at home, then I can actually really feel my shoulders just, calming down. So it's been really helpful for me personally, besides the teaching factor. The other program is called Bingo Size, and we only offer that in person because, frankly, I love talking to people, and I love like talking to them in person and interacting with them in person. And I do actually really love getting them together in one room. So we always offer this in senior residences. And a lot of times they would come in and they don't know each other, even though they live in the same building. And then they would come in, and then they come in every week, twice a week for 10 weeks. And eventually, there's talking to each other. They're calling each other, hey, are you coming today? Bingo Size is starting. So I love seeing that. And it's very fulfilling. It's very, so that to me is very gratifying. And to them, it's a lot of fun. We try to make it fun. So basically, it's a game of bingo, and then you add in exercises and health questions. So this is also an evidence-based program for fall prevention. But I do enjoy doing this in person, as I mentioned, because it can also be done virtually, but I just feel like you don't have the same social engagement if it's virtual, because you're not really, you're seeing each other on camera. And then the other thing that I do is I have this discussion series, a lot of, so basically it's a PowerPoint led discussion. So I like to just, talk about different topics, different things that affect fall. So like diabetes, hypertension, loneliness and isolation, which I feel is very much your forte. So those are the three things that I do offer for the Brigham Injury Prevention Program.
And I'm really amazed at how long these programs are, the Tai Chi for fall prevention and bingo size. But you know what? There's a lot to be said about committing yourself to a sustainable long-term program, because that's how you are able to see the improvements. Again,
Right.
there's no one and done. I mean, of course, your discussion series are one and done. It's educational. You're asking people about, about their health maybe, and if they know anybody who has these health conditions, then you'll answer the questions. But the Tai Chi for fall prevention and bingo size, it's fall prevention, but at the same time, you're creating a safe way for people to connect with each other.
That's the other thing that I absolutely love about these programs, that social part and that connection part, definitely. But you're right, they are long. So Tai Chi is a 16 session program. And again, it's a lot of it is because we're learning new forms. And in learning these forms, you're developing balance, you're developing muscle strength, flexibility. So things that have to develop slowly, that have to progress. They can't just happen overnight. And, same thing with bingo size, with exercises. There's a progression as well.
Yeah.
So that's why bingo size is 10 weeks, twice a week.
Yeah. I mean, I'm sure, and you didn't mention it, but I'm sure a level of confidence in themselves also is
You're right.
Strengthened, because sometimes people, especially after falling, they're more fearful about moving. So when they don't move as much, they become weaker and deconditioned. And then when they do have to move, they're more nervous. So your programs are long-term, which indirectly and inherently gives people that sense of confidence.
Actually, now that you mention it, it brings to mind this. I have a participant who actually just said to me last week, before this program, if I was doing these types of moves, I'd be down on the floor. But now that I've been doing it for a while, we're about 3/4 of the way finished. Now that I've been doing it for a while, she said, I am not falling on my face. So it was really, it was very exciting to hear that here's someone that, actually did have a very positive experience. And it's definitely, she's noticed the difference physically as well.
Yeah. Yeah.
But you're right about the confidence.
Yeah, I love that. I love it when you're getting, validation and people are seeing in themselves that it's working, because it makes them feel like, okay, I need to keep doing this. This is important. I'm seeing, positive changes. Yeah.
Exactly. So, it's fun. I have a lot of fun with it. So I think we should do some breathing exercises, don't you?
Yes. So what I'm going to do is I'm going to take us off of screen share. So people, actually, no. Here we go. Should we take care of this and then we'll get off the screen share so people can see us better?
Okay, that sounds good.
Okay, so let's just touch upon our other injury prevention programs. And more recently, Maria and I were trained in CarFit, which basically is we are technicians. So what we do is we look at how people are seated in their car, if they know different functions of their car, if they are aware of their blind spots, if they're able to move around easily in their car. So that way we can make suggestions and help people to feel like they're sitting up a little bit more and able to see straight ahead or even side to side or behind them, right?
Right. And then, make them feel safe and comfortable while they're driving, which is
Mhm.
really the goal of this. I just want to mention that this is nothing to do about how you're driving. We actually don't make them drive, right?
No.
So it has nothing to do with how you drive or, when you should stop driving. We don't even test that.
Yeah.
So it's purely for safety of the
Mhm.
driver.
Yeah. And it has nothing to do with your driving credit as well, or driving insurance. Again, it's just us being there, making sure, can you move here? Can you move the chair a little bit more? Maybe you're sitting too close, maybe you're sitting too far away. So making suggestions that's been shown to help people drive more safely. The next one is Stop the Bleed, which is a program that is a national campaign, because it came about because of the Sandy Hook shooting, and it teaches bystanders on how to recognize life-threatening bleed and also what to do about it. And unfortunately, it's one of those things that has been very helpful. But in the world that we live in with, mass shootings or maybe, just injuries at home, it's very important to know how to recognize a life-threatening bleed and also know what to do. So that's something we also offer.
One thing I do like about Stop the Bleed is I think after someone has trained and, knows what to do, like intellectually learns how to do it, and, hopefully you've done a hands-on training. But once someone actually knows how to do it, and you witness something like an event that requires this type of um, action, you're able to do it because you know how to do it. It's, like I think a lot of times people will just stand going, I don't know what to do. I want to help, but I don't know what to do. But if you have that knowledge, if you've had that training, you can safely say, I know what to do.
Yeah.
And it's actually really easy, right? Pressure, pack, and tourniquet. I mean, I think anybody can pressure and pack, right?
Exactly.
So that is one of the things that I do like about Stop the Bleed, because especially for me, after you've learned the training, it basically empowers you to be able to do something.
Yeah. Yeah.
Instead of just standing there feeling helpless.
Yeah.
Right.
Yeah, exactly. Because when you think about it, we can bleed to death in minutes. We can bleed to death in minutes. And that's why every seconds count. And that's why, the White House, deemed this program to be a national campaign for as many people in the nation to learn about, so that they could do something in event of some sort of an injury that has a lot of bleeding. You could use this if you're hiking up in the Blue Hills or New Hampshire and you're the only one there, or maybe you're with somebody and they tripped and they fell on something sharp. Or you could do, again, weekend warrior, gardening season, or if you're just going down the stairs and you fall and you're on blood thinners.
Right.
There's a lot of bleeding that can happen. So a lot of seniors now are recognizing that this is a program that they also need to, or would be good for them to take, because a lot of seniors or a lot of people are now on blood thinners for, some medical reason. And it's good for them to learn this type of program. Yeah.
I totally agree. Totally agree. I think, just the idea that you, as being probably the first person on the scene, can do something. Because a lot of times it does take time for the ambulance to come, for the professionals to come. But the idea that someone who's already there can do something, I think that's very gratifying.
Definitely, definitely. Like you said, it gives somebody that idea, like, okay, I could do something. I've been trained in this. Even if you can't, if you feel like, okay, this is way too much, over the top, at least that person who's been trained knows, okay, I need to call 911. I need to stay on the phone with 911. I need to stay with this person to comfort them. There's still something that you can do that's going to help that person get help.
Exactly. I think just the idea that you can do something,
Yeah,
just that the fact that you can actually that you can do something, I think that's a very good feeling for many people,
yeah,
you know.
exactly. Do you want to talk
So
about
the
the pre?
last program is called QPR,
Mhm.
Question, Persuade, and Refer. That's actually a suicide prevention program. And again, it teaches the layman just strategy. So basically, what kind of questions do you ask? And then how can you persuade someone to talk to someone who can help? And then refer them to someone. So a lot of it is recognizing symptoms or signs of suicidal ideation and being able to do something about it. Because again, I think, suicide is such, I don't want to say it's a taboo word, but we're also afraid to talk about it. But, thinking that, oh my God, and if you talk to someone who says something about, I'm going to kill myself or anything like that, um, knowing essentially how to talk to that person, I think is important for, again, the layman and just having that knowledge on how to be able to talk to them and hopefully, at the minimum, persuade them to talk to someone else, persuade them to talk to a professional and have the resources available to you on what to do when a circumstance like that comes up.
Yeah, I
So
agree.
that is another type of training for the layman,
Yeah, yeah.
for
And
everyday person.
you talked about taboo. Some people, there's myths out there about suicide that, oh, if I talk about, you know, are you thinking about hurting yourself? The myth is, oh, I might, make them do it. They might commit
Correct.
suicide because I just asked them a question. I just gave them the idea. That is a myth.
Correct.
That is a myth. If
Exactly.
anything,
Exactly.
yeah, if anything, if you see somebody who you think, has changed, they haven't been themselves, or they had just they look so depressed and sad, and your gut tells you this person might do something that, might be harmful for themselves. Ask them how they're doing. Are you okay? What do you need right now? Because sometimes as simple as asking them a question and approaching them might give them that hope, that, or maybe that's that pause, that mindful pause to
Hmm.
think about what they're about to do twice, and maybe
Exactly.
saving them from hurting themselves.
Exactly. Exactly. That's so true. That is so true. A lot of times they just need that one person who, to say, I care,
Yes.
and that's what this program does, is just to be able to recognize those signs and be able to say something or do something about it instead of, again, standing back and saying, I'm scared, I don't know what to do, and I don't want to inadvertently cause someone to do something that they shouldn't do, you know? So yeah, it's a pretty good program as well.
Yeah.
Again, if anybody, you come across these programs as being advertised or being offered in your community, please just check it out. Just check it out and see if that's something that you could probably take or could be of interest to you.
Yeah, definitely. So, again, these programs are free.
Yeah.
So, take advantage of them. And, for as far as Stop the Bleed goes, if you are a health professional, whether you're retired or still practicing, once you take this training, if you want, you can become a trainer already, and you can you can continue to spread that word, that the education out there on how to, recognize and stop life-threatening bleed. So very important. We want to do a small demonstration. So I'll start with a breathing exercise. I like doing a 2-to-1 breathing exercise. And after a few rounds of that, I'm going to turn it over to Maria, who is going to do a demonstration, a Tai Chi demonstration. So, all right, we'll start with the breathing exercise because we all know we breathe all the time, thank goodness. Thank goodness it's automatic, because if it's not automatic and we have to add it to our to-do list, we might forget to do it, right? So it's,
I actually do mention it when I teach Tai Chi. Don't forget to breathe.
yes, because people are so focused on doing the right movements that they forget, they concentrate.
Correct.
So
Exactly.
I have a ball that I like to use in my workshops, but it's not showing up in the camera. So what I'm going to invite people to do is put their hands on your belly. And so I'm going to ask you to take a deep breath in through your nose, and then you're going to pause, and then you're going to breathe out through your mouth. And I will count for you so I can pace you. Okay, this is called 2-to-1 breathing exercise. So let's breathe in through the nose nice and slowly for the count of 3. 1, 2, 3. Hold for 3. 1, 2, 3. And through out your mouth, breathe out through your mouth, count of 6. 1, 2, 3, 4, 5, 6. Let's do a few more. Breathing in through the nose. 1, 2, 3. Hold for 3. 1, 2, 3. Out for 6. 1, 2, 3, 4, 5, 6. A few more. In through the nose. 1, 2, 3. Hold for 3. 1, 2, 3. Out for 6. 1, 2, 3, 4, 5, 6. One more. In through the nose. 1, 2, 3. Hold. 1, 2, 3. Out for 6. 1, 2, 3, 4, 5, 6. So that's called a 2-to-1 breathing exercise. You can do it with your eyes closed. You could do it with your eyes open. I've had to do it sometimes when I'm driving and people cut me off and I start getting a little bit nervous. And so I kind of de-escalate and calm myself down, because
Right.
when you're stressed as a driver, you're not able to see as clearly. So you could do that as you're driving, but again, keeping the eyes open. The whole idea is to double the exhale so that way you become more and more relaxed.
So the Tai Chi program comes in, like the form has 2 different parts. So there's the basic and the advanced. So I figured today we'll do some of the advanced moves. So this one, you learn how to move forward, because a lot of times that's what we're doing. We're walking forward, right? So the first one is called, and there's this one actually, I really find one of the most relaxing forms. It's just literally just open. Breathe in as you open, breathe out as you close. And that is one of the most relaxing for me. So this is the first half of the advanced form. This is called brush knee. So brush knee left, play the lute, parry, and punch, block and close, and push the mountain. Then we come back to the middle, and we do open, close. So that's one of the segments that we do in the class. And the beauty with this program is you can do it sitting down. Essentially, just do the hands, and you do exactly what I just did, but just the hands, not doing the feet. And that's perfectly fine too. So,
yeah. I'm sure people, even if they're doing it seated, are getting the benefits of the whole program, right?
Oh, yes, definitely. The program was designed so it can be done sitting down or standing up. That's the other thing I like about this program. It's very open to a lot of people.
People get intimidated, but when they see Tai Chi, it looks so beautiful and fluid, and people are standing up. But people forget that it can be adapted to sitting.
Yes, exactly. And that's exactly what we do too, is we encourage people to sit down if you're tired or you're feeling unstable. So, and still be able to do the forms with everybody else.
I know that, when you do it virtually, you need another person to make sure that participants are being safe, right? So that way you're, as a teacher, as the instructor, you're trying to conduct and teach the forms, but you need a second person to make sure that people are being safe or nobody has fallen, because that's the whole idea is it's a fall prevention program. You don't want to,
Right.
get hurt, right? Yeah.
Yeah, that's especially true when you have big classes. When you only have, a few people in the program, it's not quite as critical because you can see everybody. But when you have two screens going or, a lot of people, then it really is critical to have that second person so that they can watch everybody else.
What's the program that you like to offer the most? I know you get really excited about all the programs you offer, but which one do you think, which one do you like offering?
I do like both because they do different things, Tai Chi, because for me, it's relaxing. It's, that slow pace, which I am not. I am very, I'm a type A personality. So it forces me to just, calm myself down and get myself together. So I like him for different reasons, is what it is. So, and then bingo size is fun. We have music, we have, conversation and all that. So it's a lot more interactive in that sense. So it's a very different vibe for each of them. So I don't know if I can pick one.
That's the beauty of what we do because we offer different ways, different touch points and how we can empower and educate older adults in injury prevention, right? So yeah, I love all the programs I offer because I feel like they're a part of me. I mean, I only offer the ones that I feel like it's research proven, makes sense to me. And if I can kind of put it in a way that's going to really be impactful for people, I love offering it. I want to thank you, Maria, for being my guest speaker and helping me share the message, what it is that we do, injury prevention professionals and different types of hospital systems out there that can offer different types of services for people, right? Like you talked about the level 5s, level 4s, level 3s, they help patients become more stable so that they can be transferred to a higher level hospital. It doesn't make the hospital better than the other one. It's just, like you said, it's like hospitals volunteer to become a certain type of designation. And if they are going to commit to that, then they need to uphold all the different types of requirements. And they have the trained personnel and also the number of patients who are going to really need that service. If they don't have that many patients, then the designators might say, well, it's good that you are volunteering, but you don't have enough patients
to
do it.
Exactly. So,
yeah. So Maria, what is the one thing or two things that you want the viewers out there to learn about your programs and how to get in touch with you in case they want to reach out to you?
So essentially my programs, as much as they're for the elderly, they're really, anyone can take them. Tai Chi for Fall Prevention has been designed for anyone with mobility issues, with pain, so anything like that. So it doesn't have to be, you don't have to be old. You can take it. If you're interested in it, you can take it. And you can contact me through the Brigham, and my email address is mtumang@bwh.harvard.edu.
Yeah.
Feel free to call me or to email me, and we can chat about different programs that we offer.
Certainly, if you're interested in any of the programs we listed, check with your senior center. They might offer these very programs and maybe it just didn't, occur to you to sign up for them. So definitely check with your senior centers. If they don't offer these programs, ask them to maybe find somebody who in the area to offer them. So, there's plenty of injury prevention people out there. And they don't even have to be injury prevention professionals. You could just ask, maybe somebody who does yoga or somebody who has a business in Tai Chi, maybe they can come and do the programs for you. So there's different ways, right?
And don't forget, we also offer these programs virtually. Well, certain programs virtually. So there's also that option.
We do actually have a Caring Collaborative fall prevention program that we do virtually, and we've been lucky enough to offer it across the Commonwealth. So definitely reach out to us. All right, so I want to thank you, Maria, and I also want to thank the Quincy Health Department for continuing to sponsor this program. This is Debbie Lynn Timmy, Tufts Medical Center's Injury Prevention Coordinator. I want to wish you a safe and happy day.